this country. And what they're now seeing is that the rate of cases, the rate of new infections, is doubling about every 3 days. That is a dramatic increase in the rate of infection. And this whole discussion all along has been, how fast does the rate of increase spread? And can we slow the rate of increase? We're not slowing it, and it is accelerating on its own. One of the forecasters said to me, we were looking at a freight train coming across the country. We're now looking at a bullet train because the numbers are going up that quickly. And the most challenging point about the increasing numbers is where the numbers will apex. What is the high point of the numbers? And the apex is the point where we have to be able to manage the capacity. We had projected the apex at about 110,000 hospital beds, and that's the number I've been talking about. The new projection suggests that the number of hospital beds needed could be as high as 140,000 hospital beds. So flatten the curve, flatten the curve. We haven't flattened the curve, and the curve is actually increasing. That means the number of hospital beds, which is at 53,000 beds, 3,000 ICU beds. The anticipated need now for the height of the curve is 140,000 hospital beds and approximately 40,000 intensive care unit beds. Those are troubling and astronomical numbers, and as I mentioned, are higher numbers than had been previously projected. We are exercising all options as aggressively as we can. That rate of increase, that apex, they project at this time could be approximately 14 to 21 days away. So not only do we have a spike in the increase, when you spike the increase in cases, it accelerates the apex to a point where it could be as close as 14 to 21 days. We're exercising all options. We're doing everything we can on every level to, quote unquote, slow the spread, flatten the curve. We've closed businesses. We've reduced street density. We had an issue in New York City. I spoke to Mayor de Blasio. I spoke to City Council Speaker Corey Johnson. We'll have a plan that I believe will be in place by noon today. And we have increased testing to the highest level in the United States and the highest per capita level on the globe. No one is testing more than we are testing. So in many ways, we have exhausted every option available to us. We've closed all the businesses, we've reduced the street density, and we've increased testing to the highest level in the country. We're also trying all the new drug therapies, the hydroxychloroquine, which the President speaks about and is optimistic about, and we hope for optimistic results also. We're actually starting that today. The President and the FDA accelerated that drug coming to New York. So the hospitals will start using that drug today. The FDA also authorized an experimental procedure by the New York State Department of Health where the Department of Health actually takes plasma from people who are infected, who have the antibodies, and will try putting that plasma into a person who is still struggling with the disease, hoping that the antibodies make a difference. We're also pursuing a new level of testing, which will test people's blood to see if they have antibodies for the coronavirus, which means they may have been infected and resolved and never knew it. But if you had the coronavirus and resolved, you now have an immunity to the coronavirus for some period of time. Most experts suggest it's a significant amount of time. That would be very important for us to know, because these are then healthcare workers who could go back to work. These are workers who could return back to the private sector. But the inescapable conclusion is that the rate of infection is going up. It is spiking. The apex is higher than we thought, and the apex is sooner than we thought. That is a bad combination of facts. So slow the spread. We'll still keep doing everything we can, but it is clear that we must dramatically increase the hospital capacity to meet that highest apex. And we have to do it very quickly. Again, the apex could be here in as little as 14 to 21 days. And you're talking about a very significant logistical, operational movement to increase that number of hospital beds and do everything that you need to do related to the increase in hospital beds. There are three elements that are necessary to increase the hospital capacity. First are obviously the availability of the beds. A bed without staff is virtually useless, and a bed and a staff without the right equipment is virtually useless. So you have to complete all three at the same time. As far as beds, we have told the hospitals, I'm going to speak to every hospital administrator today, hospitals must increase their capacity by 50%. The goal is to ask them to try to increase it by 100%. Remember, we have 53,000 beds. We need 140,000 beds. Even if they did increase it by 100%, you'd only be at about 100,000 beds. You need 140,000 beds. Emergency hospitals like the 1,000-bed facility that's being built here will be helpful. The emergency hospitals that we're building at Westbury and Stony Brook and at the Westchester Convention Center will be helpful. But they're nowhere near the number of beds that we're going to need. I have no problem using the dormitories all across our state campuses, our CUNY campuses, our state university campuses. I'm speaking to hotel owners about taking over their hotels to put patients in. I will turn this state upside down to get the number of beds we need. But we need the staff for those beds. And we're calling and contacting all retirees in the healthcare field. We're calling all professionals in the healthcare field, whether or not they work in a hospital. They can work in an insurance company, a clinic, or whatever. But we want to enlist as many staff as we can and as many backup staff, because healthcare workers will get sick. And this is going to go on for weeks, and you can't ask a person to work for 14 days consecutive or around-the-clock shift. So we'll need a backup reserve staff. And equipment, masks, PPEs, and ventilators. And of those three, the greatest critical need are ventilators. Now, ventilators, you say ventilators, nobody